Good afternoon, everyone. Thank you for joining us. I'm Governor John Carney. Thank you for being with us this afternoon for the press briefing, much similar to our COVID-19 briefings that we had over the last 2 years. This year, it's more of a winter virus briefing, as you can see. I'm joined here on your screen, with by Secretary Molly McGarrick, Secretary of Department of Health and Social Services, and our special guest, Dr. Priscilla Pazzi, joining us with bringing her expertise in primary care and community health. Thank you for joining us from Christiana Care. Alana is with us as well, our sign language expert for the deaf and hard of hearings. We wanted to have this press conference once again to bring to the public's attention certain concerns that we have over the winter virus season. We're heading into the late fall holidays of Thanksgiving, the December holidays, and into the new year. And of course, the last 2 years with COVID-19, we saw a significant surge in COVID cases in both years, starting just about this time, just before the Thanksgiving holiday and into the December holidays, and with a peak we'll show you in a minute in early January. And the purpose of having this meeting is to add in two other concerns. Less of a concern for COVID, although it's still out there, and we want you to be aware of that. But we have the flu virus, which was pretty non-existent the last 2 years as people masked up and children weren't in school and in person and the like. A lot of protections going on, and the flu season was pretty light. And then we have a complicating factor of the RSV virus, which others, experts here, are going to talk more about that. That's a concern, particularly for young children, and we'll show that in the context of an anticipated surge in COVID-19. So very different in that sense. We still are in a public health state of emergency, mostly to allow a certain staffing provisions for hospitals, long-term care facilities, and others, enables us to activate the National Guard on a local basis if need be. They're not currently activated. So a very limited basis with respect to a public health emergency and some of those powers that we've been given. So let's go right to the slides. The main message today is that we've been brought to our attention by healthcare officials and professionals, physicians, primary care physicians. You'll hear from Dr. Pazzi in a minute about this combined threat of influenza, so flu season. We'll show you some of those numbers. RSV, which is a virus affecting children, affecting everyone, but younger children in particular, and then the anticipated fall surge for COVID-19. So let's take a step back and look at the data and the dashboard that we followed for 2 years, and you can see there the new cases on a 7-day moving average at 131. If you think about where we were a couple of years ago, we wanted to be under 100 on a 7-day moving average. It's also very important to point out that these numbers are not as reliable as the numbers that we used in the past, mostly because we've got a lot of in-home testing going on. And so those positive tests not being registered on our data dashboard. So the percent of the tests that are positive, you see it at 7%. We've always tried to have it below 5%. Is not a very reliable number. The reliable number on our data chart is the number of people that are hospitalized with COVID. And you can see that number as of a couple of days ago at 86. Just to give you some context and comparison, last year at this time it was 148. So a little bit higher than where it is today, and then 127 back in 2020. In 2020, this was the beginning of that winter run up. In 2021, we had a little bump up prior to November here in late September and October, and then the run up, the peak in both of those years was in the second week in January. So part of the purpose of this briefing is, again, to bring to the attentions of the public and all concerned where we think we are, what are the different factors with the flu, with the RSV virus, and to provide just messaging around taking protective measures. One of the things that's considerably different is the level of vaccination that has occurred for COVID-19. And here are the numbers. We've administered over 2 million vaccines over the last 2 years since they were available. And those that are Delawareans who've completed the primary series, whether it was a 1-dose or 2-dose vaccine, at 72% or over 700,000. And if you break that down, if you can see the numbers below that, 71% for Delawareans, all Delawareans 5 years old and over have completed their primary series. So 3/4 of Delawareans, 80% for 12 and over, 82% for 18 and over, and then the most highly vaccinated population, 65 and older, at 95%. And we also know that that's the most vulnerable population. So these are factors that were not in effect certainly in 2020 and 2021, obviously people getting vaccinated. So there's still an opportunity, frankly, to get vaccinated for COVID-19, and we would encourage you to do that. We would encourage you, if you haven't gotten your second vaccine on a 2-dose vaccine, to do that, and of course be boosted as well. Secretary McGarrick will talk a little bit about that later. So here's the number on the booster. We're just not seeing as the higher number of people getting vaccinated. Even those 65 and over, only about 24% have gotten that booster. So think about that. So let's look at one of the biggest concerns and the hardest, the most reliable data point that we have, which is the hospitalizations. That is people with COVID-19 that are in our hospitals. First of all, you have to remember that there are other people in our hospitals. Secondly, that the messaging isn't don't go to the hospital, is not to tell you not to go to the hospital. If you need to be there, you should go. But just to remember that if we can keep our flu numbers down, keep our COVID numbers down, do those protective measures, we're protecting hospital capacity. So if you look at this graph, it's actually 2 years back to back. So that starts in the summer of 2020. You can see that little decline there as you got into July. And then right where we are after the October 1st, there is the run up for the first year, which peaked in January of 2021 at 474. Remember, lots of other things going on in the hospitals at that time, different from any other time. As we go into 2021, the rest of the year, we had a little bump up in the spring. Then the summer months are always pretty good shape. Another bump up in September, October, and then the run up just where we are today in the November to January timeframe. It peaked all the way up to 759 and really was the most critical stage for Delaware under COVID-19 as you saw that run up in our ability. The hospitals were able to address that. We did provide additional resources through our Army and Air National Guard and other things, but we just don't want to see that, and we just want to be a little bit protective of that as we go into the run-up this year. The latest number, November 9th for this year, is 86. So that compares with about 140 in 2020 and about that same number on this time in 2021. So a little bit, we're down where we were 2 years ago in each of those 2 years, but just prepared for that run-up. Remember, the context, lots of people vaccinated, lots of people boosted, so much more protection going on than in 2020 and 21. Didn't have much of a flu season last year and the year before. Today, we're seeing higher numbers with flu cases, 772 so far, 483 of those just in the last week. Our public health professionals will tell us, this is early in the flu season, so there's more to come, and we just want to be careful and cautious of that. What's the effect on hospitalization? You can see that last number of 20, probably a much lower number last year and the year before, but added to that number of 86 that you saw a minute ago. So let's be conscious of that as we think about protective measures that we need to take to prevent the spread of the flu. Flu vaccination, there's been a pretty good year for flu vaccination, but only 25% of the total population. You'll see in a minute that most of that is for Delawareans 65 and older. So that's a good thing because there most at risk. And we'll see those numbers next. You can see the breakdown for those 65 and over getting their flu vaccine, almost 60%. So pretty good number there. We'd like to push that up. So if you haven't gotten your flu vaccine, it's not too late. Actually, some people would say maybe now's a good time to get it. We're still early in the season. I'll let Dr. Pazzi and Secretary McGarrick talk about that if need be. And then RSV, and Secretary McGarrick would talk about this. Something a little bit new, certainly new for me. 505 cases so far this season. 104 of those cases, or 20%, just in the last week. So I'm told, and again, we'll hear more about that from our experts, that that's a little bit on the decline, but again, adds to the need for capacity there. So the message is, let's do the things that we know that work. We've seen these surges in the past 2 years. It started right about now in mid-November, just before Thanksgiving and the December holidays. In both years, the peak was in the second week in January at a pretty high level, particularly last year. And we have we're in way better shape this year with respect to COVID. High percentage of people that are vaccinated, but we have the flu and the RSV to think about at the same time. So just thinking more globally about our healthcare delivery system, particularly the hospitals, long-term care facilities, our vulnerable populations, those that are seniors. So what are the things that we've been talking about? It's really the same thing. If you're sick, stay at home. You don't want to be out there bringing the virus with you, whatever it might be, the flu or COVID, and spreading it to friends and neighbors. Get vaccinated and boosted when you're eligible. You saw we've got a large percentage of the population that's already vaccinated for COVID-19. Not as many people have been boosted, so that'll help you as well. Get your flu shot if you haven't, and also be very thoughtful about the risk in various venues with respect to whether you should wear a mask or not. Think about others. If you are feeling sick, good idea to wear a mask so you don't spread it to your family members and others. Just be thoughtful about that. So that's the situation from a very high level. We're great to have two experts on with us, Secretary McGarrick and Dr. Pazzi, and I'm going to turn it over to Secretary McGarrick now. Thank you both for joining us, and we look forward to the questions we have at the end of the briefing.
Thank you, Governor. Always an honor to be with Dr. Pazzi, and obviously with you as well, Governor. And I think this is a really important conversation for us to have. As the Governor pointed out, we are not in a peak situation right now, but this is the time of year that we have seen over the last 2 winters that we start to go up the hill to a peak. And so really important to have this conversation and to talk to everyone about what they can do to keep themselves safe. And want to specifically lean into the bivalent booster. And there's a lot of confusion. People even saying, well, what does bivalent even mean? What's that? So the bivalent booster means there's 2 strains of the virus, or it targets 2 strains in this vaccine. So it's the original strain as well as the Omicron strain. And that giant peak that the governor showed that caused all of our hospitalizations, again, that's because of the Omicron strain. And there's been various different variants of Omicron. And so putting an Omicron strain in the booster is going to increase the efficacy. It's going to give us more protection. And so again, when you hear people saying, get boosted, it's really, again, because as the virus is evolving, we need to evolve our response. And so we want a vaccine that is more closely matched to what's circulating out in the public. And so for people who have again said, that wonderful number, I want to congratulate everyone. It's a number to be proud of, that we have 95% of those 65 plus that had their primary series. Please do not forget the booster. This bivalent booster is going to be such a wonderful source of protection for you as we head into this winter. And so when can you get this booster? Again, a lot of confusion around this. A lot of people saying, well, I didn't even know that this existed or if I was eligible. So if you are 2 months after completing your primary series, so as the governor mentioned, those 2 doses of Pfizer or Moderna, or if you had the 1 dose of Johnson & Johnson, you can get this bivalent booster. And then if you've recently had COVID, as long as you are 3 months past your infection, you can go ahead and get, again, this bivalent booster. So next slide. And who is eligible? People 5 and older. And again, we want everyone 5 and older to please get the booster. If you haven't completed your primary series, do that and then get the booster. But we think this is really important, again, for our friends who are 65 plus. Having the primary series alone without the booster is not going to give you the same level of protection. And again, it's because this bivalent booster much more closely matches what is circulating in our community. So as we head into this time of year where unfortunately we share hugs and viruses, having the maximum protection possible, especially because it is our friends 65 and older that have really borne the brunt of the COVID-19 or SARS-CoV-2 virus, and where we've seen a lot of the hospitalizations and unfortunately the deaths occur. So we really want everyone to get this booster, but especially if you are 65 plus and you are 2 months past your primary series or you're 3 months past the COVID infection, please go out and get this booster today. And if you're wondering, well, where can I get them? Again, vaccines.gov will give you sites. Public health continues to maintain clinics. We have those available. Not just, again, we recognize that not everyone has access to a primary care doctor. People are uninsured. And so when you go on this site, you will see options if, again, you are uninsured or underinsured or don't have access to a doctor. The federally qualified health centers have vaccines. Again, your primary care, have conversations with your primary care doctor, pharmacies up and down the state. Thankfully, unlike when these vaccines first came out, access to the vaccines is not an issue. Staffing at the pharmacy may be another story, but you should be able to very quickly. I was able to get a same day appointment, and we're hearing that for a lot of people. So next slide. As the governor mentioned, and really this is going to be, again, important that we're having this conversation today because the last 2 winters have been dominated by COVID-19. And this is going to be the first winter where we are starting to see, and flu has roared back in with a level of intensity that is causing us to notice and to really wonder what the flu season is going to hold. So there were 772 cases through November 5th. They are doubling. The cases are doubling and again, picking up in terms of numbers. And the season officially began on October 2nd. And when we look back to 2021, this time last year, we didn't even have our first flu case until November. So the fact that we have 772 cases is definitely cause for notice and us to pay attention to what's happening, because as the governor said, it absolutely impacts hospitalizations. In a normal flu season, we see thousands and thousands of visits to emergency departments, primary care offices, et cetera, for people who have flu. So far, we've had 14, again, flu-related hospitalizations. I'm very grateful that we haven't had any deaths, and we have had a pediatric case reported. Next slide. Taking the learnings and the lessons from the COVID-19 pandemic, the wonderful team at Public Health, again, we heard and have heard consistently throughout this pandemic that people really appreciate the real-time data. We know that policymakers, people in hospitals, and the public, it's very important to understand the level of virus circulating. And so again, the wonderful team at Public Health took those lessons and learning from COVID-19 and applied them. And so we're happy to say that this is the first winter season and flu season that there will be an influenza dashboard. So if you go to de.gov/healthy community, for those the nerds out there and armchair epidemiologists, you can track the flu cases in real time. Next slide. Again, want to lean into the tools that we have available to us. As the governor said, every case of flu that we can either prevent or make less severe such that it doesn't result in a hospitalization is going to be really important this winter. All Delawareans 6 months and older are eligible for their flu vaccine. You can get it just like I did the same time you get your bivalent COVID-19 booster. I got mine in the same arm, and it was actually, I was worried I was going to have a really sore arm, and it was totally fine. And it was very convenient. We know people are busy. And so it is absolutely an option that, again, depending on when you had your last COVID vaccine or COVID infection, you can get both of these vaccines together. And, we get this question a lot. And again, I think this is, people are more aware of this, having lived through the almost last 3 years of the COVID-19 pandemic. Even though vaccines are not going to prevent every case of an infection, they still lessen severity. And so they reduce the likelihood that someone is going to get severely ill, potentially end up hospitalized, and then potentially, God forbid, eliminate the possibility or greatly reduce the possibility that they could end up passing away from the virus. Again, want to remind everyone, vaccines are available through medical providers, pharmacies, our federally qualified health centers, as well as the DPH clinics and public health partners with community leaders and community groups throughout the state, again, to try to bring and address access issues to make sure that we don't have disparities around flu vaccination rates because people don't have access to a doctor or have difficulty taking off work or have transportation challenges. Next slide. You will start to see our stepping up our marketing campaign again to remind everyone. And I will say we have heard, especially during a pre-COVID world, people say, well, I want to wait until December because I want to make sure my flu vaccine lasts. And flu doesn't really pick up until more as we get more into late fall and early winter. That is absolutely not true this year. Again, as you saw, we have over 700 flu cases, and it also takes about 2 weeks from when you get your vaccine until you achieve that level of immunity. So please, if you are waiting to get your flu vaccine, please go out and get it as quickly as possible, again, to protect yourself and protect your loved ones. Next slide. As the governor mentioned, the third respiratory virus that we're really watching and has caused a pretty high uptick in hospitalizations for kids birth to 4 is the respiratory syncytial virus, otherwise known as RSV. We've seen 505 cases in Delaware. We have seen in surrounding areas that cases are starting to level off. That remains to be seen in Delaware. But in terms of who this impacts, or really the hardest hit populations, it can occur in any age. For typical adults, you probably wouldn't even notice the difference between that and what you would call a cold. But we see pretty severe cases in children under 2, again, because their airwaves are smaller. And so as there's inflammation caused by this virus, they can actually have significant breathing issues that will result in hospitalizations. We also see, again, that in adults 65 and older, RSV can cause more severe disease. We see about 14,000 deaths around the country from RSV in those 65 plus, and we see hundreds of thousands of emergency department visits across the country for RSV during this time of year. Next slide. So I think you all could probably tick off, what are typical symptoms of a virus. Unfortunately, RSV, again, for an adult doesn't have a lot of distinguishing features, but as I mentioned, in children can cause really more severe symptoms. So often, again, this starts off as a cough, congestion, runny nose, sneezing, especially in infants. Maybe your baby seems a little fussy, the feeding schedule's off, not eating, or there's something that's different in how your baby's eating. And then unfortunately, they can progress to more severe symptoms. And really in this case where there are breathing issues, as the governor said, we absolutely want to encourage people to seek emergency care. If there's shortness of breath, your child's struggling for breath, wheezing, your child's chest is caving in, indicating that they are unable to draw a breath and they're really laboring to do so. And especially if you see skin or fingernails turning blue or purple, that is due to a lack of oxygen. And again, we do not want people to wait and want people to seek emergency care as quickly as possible if your child is, again, struggling to breathe, or again, you notice that blue or purple skin or fingernails due to lack of oxygen. Or your baby is sleepy. I'll let Dr. Posse go into more of these details as a pediatrician. But, again, absent those more severe symptoms, please talk to your doctor or pediatrician if you're not sure what to do next. Again, feeding schedules off, fussiness, runny nose that seems to be persisting. Next slide. Again, as we, and I want to be clear, this is prevention, as the governor mentioned, really around all of these respiratory viruses, things to keep in mind, again, as we head into the time of year where our behavior changes, we're indoors more, we're indoors with lots more people, we're not necessarily doing the outside events that provide that fresh air that keep these viruses at bay. So we, again, really want people to get vaccinated right away for both flu. And again, if you've not had your bivalent booster, we know that this is a privilege for some and not available to everyone, but if you can, please stay home if you are sick. If you do have a cough or sneezes, cover with the tissue. The ever popular sneeze into your arm is always available. And please dispose of the tissue or paper towel or whatever you're using to cough or sneeze into afterward. Continuing to wash hands frequently, this makes a huge difference, as Dr. Posse can attest, around infection control. And also using alcohol-based hand sanitizers if you don't have access to soap and water. Avoid touching your eyes, nose, and mouth. That is a pathway for these viruses to get inside your body. You can sanitize commonly touched surfaces. This is really important for cold viruses. They are sneaky and can last a very long time. Also want to lean into, again, increasing ventilation. I know it's cold out there, opening a window, having that fresh air exchange to the extent you can, filtering the air. That really does just reduce the dose of virus that you're potentially inhaling that, again, could cause illness. And, when cases are high, we don't want people to feel embarrassed about wearing a mask. It is still okay. It is an important prevention tool to wear a mask if either cases are high and you don't want to get sick, you don't want to miss your really awesome post-Christmas trip to the Bahamas. Wear a mask so that you don't potentially, you really get vaccinated, wear a mask, make sure that you're staying well so that you can go on that important trip. Or again, if you're visiting relatives that are older or sick or immune compromised, think about what you're potentially bringing to them and consider, again, wearing a mask to keep them safe in the run-up before you see them. And obviously, we know that a lot of people in this state and across the country are immune compromised and really need to continue to wear the mask for their safety or potentially for the safety of a loved one they lived with. So it is still an important tool, and we don't want anyone to feel ashamed or embarrassed about proudly rocking their mask when they go into Wawa or wherever you're traveling this holiday season. And last, before I turn it over to the wonderful Dr. Posse, we are having a Facebook Live that will be on the DHSS Facebook page. Again, just another opportunity for a dialogue and a conversation around what we're seeing. Give you all an opportunity to ask questions or to hear feedback from other clinicians about what they're thinking about and focusing on as we head into this season of viruses. And again, that's on the DHSS Facebook page tomorrow, Tuesday, November 15th at 6 p.m. And with that, I will turn it over to Dr. Posse. Thank you.
Hear from Dr. Posse. I would like to first make sure I'm unmuted. Just want to thank Secretary McGarrick and her team for the work you're doing, for all this really good information about preventive measures that folks can take, particularly about not wearing a mask when you're sick, when you're cautious about spreading anything to others. Don't be embarrassed to do so. You go to lots of various retail establishments and you'll see that the folks that work there are wearing masks. A really important thing to do this time of year. Good information about RSV, particularly a challenging situation in our communities. We're lucky enough to have with us today a public health expert, primary care physician, who comes to us with some advice as well. And I'm going to turn it over to Dr. Posse. Thank you, Dr. Pazzi, for being with us and for the work that you do, keeping people healthy and safe.
Great. Thank you, Governor Carney, for the invitation, and always a pleasure to be alongside Secretary McGarrick to be able to provide health education and preventive measures to our Delawareans. Next slide, please. So it is cold and flu season, and as we have talked about today, that we have 3 viruses that are really coming and starting to provide illness in our children and our family members. So as a pediatrician, cold and flu season is very common, and I certainly want to provide our parents and caregivers with some helpful tips to be able to monitor these illnesses in their children. So all of you really should anticipate a viral illness in your household as our children are in school, in daycare, and in school activities. They're interacting with other children. And as one child gets sick, another child may get sick. And so if your child comes home with symptoms, here's some helpful things that you can look for. Next slide. So winter viruses may look similar. As Secretary McGarrick went over the symptoms for RSV, you might find that they are similar to COVID-19 as well, and also to the flu. So as we often say, when in doubt, you can check it out. Get a COVID-19 test. As soon as that cough or that runny nose starts, you can take a home test. Many people ask, where can I get a home test these days? And what I certainly encourage you to do is to check with your pharmacist. You can check with your primary care provider or your pediatrician, and they can direct you on where to get a home test based on your insurance status or your location. Once you take that home test, if it's positive, we recommend for you to stay home. But if it's not positive, there is likelihood that there could be another virus that's making you sick. So we encourage you to then monitor for the symptoms. A very common symptom we encourage you to monitor is to check for fever. The likelihood is that the higher the fever and the more days your child has the fever is a greater severity of illness. And so this should really put you on alert to watch more closely for symptoms in your child. So some of the symptoms that Secretary McGarrick already mentioned is cough and runny nose and changes in breathing. But other symptoms are a decrease in appetite and decrease in energy. As more symptoms start to come about and you start to see more changes in behavior, this is when we certainly encourage you to reach out to your pediatrician or even seek care in an urgent care facility. This way we can make sure that your child is getting treatment as soon as possible and we're not delaying care. And of course, one of the greatest prevention measures that we can take is to get your flu shot. As Secretary McGarrick said, we know that it's November. Some might think, is it too late to get your flu shot? Well, it's never too late to get your flu shot. And so all eligible Delawareans over 6 months old can get a flu shot throughout the flu season if you have not done so already. You can get a flu shot from your pediatrician, your primary care provider, or a pharmacy as well. Next slide. So as we enter into holiday season, we certainly want all of you to be able to enjoy the holidays with your family and friends and illness-free. Certainly do not let COVID-19 freeze out your holiday season. And so here again are some helpful reminders for prevention. One is if you start to feel symptoms, certainly wear a mask. Feel comfortable to wear a mask, and certainly encourage others around you to wear a mask, especially those that are high risk. If you're feeling sick, we want you to stay home. At the start of those symptoms, you can stay home. You can also let others know that you're feeling sick so they can start to monitor their symptoms as well. Of course, as I mentioned, you can get tested before and after the holiday season. So before you go to your parents' household, to grandparents' household, especially if you may encounter those that are elderly or those that are high risk, you should know your status to see if you're ill. When you return back from the holidays, you can test as well to make sure that you've not caught any viruses or that you would pass it along to a family member. And of course, I will certainly emphasize the importance of getting vaccinated and boosted. You can still get your COVID-19 vaccine, you can still get a COVID-19 booster, and also the flu shot. So similar to Secretary McGarrick, I received my COVID booster and my flu shot on the same day in the same arm, and I did very well with both of those. And now, as both the governor and Secretary McGarrick highlighted, as we're starting to see more RSV cases, we're also starting to see a rise in the hospitals. And so we certainly want to encourage you all to continue to enact those preventive measures that we know that work. Next slide. So I certainly now want to turn it back over to the governor. I want to thank all of you for the opportunity to really just provide our parents and caregivers with some helpful tips on how to maintain their child's illness, but also to prevent illness in the household.
Thank you very much, Dr. Pazzi. Thanks for joining us today. And to those who joined the press briefing at home or at work, we appreciate your attention as well. It's mostly about bringing to your attention the kind of this triple threat of winter viruses that we're seeing. We did the normal reference to the COVID-19. We're in a pretty good place there with respect to Delawareans who are vaccinated. And we know that the winter surge is in the offing here as we approach Thanksgiving. But the fundamental message really is that we are concerned about the combined threat of the flu, of RSV, and of COVID-19. Going back to the slides on hospitalization, we're at 86. The latest number that we had for hospitalizations in Delaware was at 86, and that compares with 127 in 2020 and 148 in 2021 before that winter surge. And so the message is let's get ahead of it. Let's take the precautionary measures. Let's be careful. Let's pay attention to our loved ones, whether they're our little ones or our elders, and make sure that they're protected and make sure that they're getting the care that they need. So with that, I know we have some media that have joined us, and open it up to any questions that they might have. We have some pre-submitted questions, and I'm sure if they're not answered in these questions, we'll get to them afterwards.
And Governor, I apologize. I was so excited to hand it over to Dr. Pazzi. I neglected to mention the lead town hall that we are having tonight. So there is a public forum that's hosted by members of the General Assembly. Information was going out to families today. If people have an interest in attending and want more information about how to log in, they can email the address that's on the screen, ddoe@doe.k12.de.us. Thanks, Governor.
Thank you.
All right, Governor, it's Emily. I would just ask any of the attending press who has questions, if you could please just raise your hand on the Zoom screen and I will turn the floor to you. So it looks like our first question is going to come from Mark Fauser of WDEL.
Yes, hi, good afternoon. Can you hear me okay out there?
Can hear you, Mark, well. Thank you.
Regarding RSV, is there a vaccine or treatment for that? And if RSV is not COVID or flu, what does it most resemble in terms of its spread and who it affects?
Turn that over to either Secretary McGarrick or Dr. Pazzi.
I defer to Dr. Pazzi.
Thank you. Thank you, Mark, for that question. It's a good one. So there is not currently a vaccine for RSV, and the treatment is supportive care. So we tend to treat the fever and also ensure that we're providing plenty of fluids to the person that is ill. If a person is hospitalized with RSV, it is generally because they are having breathing symptoms or trouble with breathing. And so oftentimes they may receive oxygen support to help with those symptoms. To your question about who it can affect anyone. We generally see it in ages 0 to 2. We are seeing a peak in ages 0 to 4, and being mindful that RSV can really impact anyone across the age spectrum, to the point we're also seeing it in our 65 and older. So we certainly want to be cautious of its spread. It is highly contagious, so it can spread again simply by touching hands, by droplets. And so that's why we're really encouraging the preventive measures. I hope that answers your question.
Thank you.
Other questions? Raise your hand and Emily will get to you.
All right, our next question will come from Carl Baker. Carl? Let's see. You should have the floor now.
How about now? Can you guys hear me okay?
I can hear you fine, yep.
Hello, Governor. Thanks for taking the time. I have a question on a different topic. I understand you had a conversation in recent weeks with Pennsylvania's Governor Tom Wolf about the Port of Wilmington. If that's accurate, what exactly was did that conversation entail?
Yeah, I did have a conversation with Governor Wolf a couple weeks ago. I guess the Governor Wolf and I have become pretty good friends, particularly during COVID-19, as we tried to coordinate our efforts, cross-border efforts. We have shared interest in promoting commerce on the Delaware River and Bay and our ports, and historically, that interest has turned into competition. And so we're trying to find a better way, like a rising tide lift all boats type of approach. There's going to be some competition, obviously, among port operators, and obviously we have some advantages with labor and being closer to the bay and the ocean. But there's interest in maybe trying to work together, at least having those conversations, and I think that he initiated that. I told him that there would be interest. Right now, the Philadelphia ports are preventing the permit that we need to expand our Port of Wilmington without merit, we believe. And so I told him if we were going to have any conversations, there needs to be a better approach there.
Does that mean that the proposal, if that's an accurate way to describe it, that the Governor Wolf put forward was for a regional port, one entity that oversaw all port facilities along the Delaware River, or in Delaware, Pennsylvania?
No, I don't think it came anywhere close to that. It was more a conversation with finding ways that would work. We could work together. Look, I've been working on the Wilmington port for, over 20 years, since I was working for then Governor Carper, and the state purchased the Port of Wilmington from the city of Wilmington. And this issue of competition, and particularly among the rates that are charged to customers, has always been kind of right at the top, and we've tried to find ways so that doesn't become a race to the bottom, if you will. We've always been very competitive here in Wilmington, particularly as a function of a very productive workforce. So I think it's really more thinking about ways that we can work together as opposed to competing all the time.
Governor, your next question will come from Emily Lytle from the News Journal.
Good afternoon. Of course, one big part of this, Governor, is the workforce and how the workforce is going to keep up with the demand of this winter. So I wanted to ask a little bit about that. If y'all could talk about how workforce shortages play into the concerns around flu, RSV, and COVID, and what I know that there has been calls for people who, especially pediatric nurses, to fill in spots where there is a need. Can you talk a little bit more about what that looks like specifically, if there are any incentives for specifically during this time as we head into the winter?
Yeah, Emily, it's a huge issue, and not just an issue in healthcare and hospitals, but an issue basically in every business sector that we have, including state employment. We're having a very difficult time attracting potential applicants for vacancies in state facilities, healthcare facilities, detention centers, correctional facilities, all of the above. And the same is true among our long-term care facilities, hospitals, healthcare facilities in general. Those workers have been tremendously stressed during the last 2.5 years of COVID-19, which makes the situation worse. We have put a lot of the federal monies that we've received for kind of training programs and other ways of getting assistance to the hospitals. They've created incentives themselves. I know that Secretary McGarrett and others might talk to. So yeah, it is the biggest reason that we're still in a public health state of emergency, if you will. So there are certain things that we can do with respect to licensing to enable nurses and others to work in and with various populations. So yeah, when you talk about hospital capacity, more than anything comes down to that. So something that every sector is dealing with. It's not just healthcare, but particularly acute in healthcare. Secretary McGarrick, anything there?
You covered it really well, Governor. I think we hear frequently from, I think we all probably know somebody who's a healthcare worker who has just said the last almost 3 years have just been brutal, and there's a level of exhaustion setting in. And so that's why part of a reason, again, we want to have this conversation with the public today to make sure that we can maintain capacity by doing what we can to prevent ourselves, our loved ones from getting sick enough with at least these viruses. Obviously, people are also coming to the hospital for chronic diseases, traumatic issues such as car accidents. There's limited, unfortunately, at least in a short term, limited things we can do to address those issues. But one thing we can do, again, is do our part to, again, really try to reduce these seasonal winter viruses so that we can really maintain the hospital capacity for the more severe cases, as well as, again, people who need to go for cancer, chronic diseases, heart attacks. The reasons that we still exist even in a world where we're heading into winter 3 with COVID. It is an important issue that we maintain access and support so that, again, everybody who needs the hospital can get there, virus or otherwise.
All right. And Governor, as you mentioned, we had some pre-submitted questions before the press briefing began. And so I'd like to ask one that we haven't covered yet from 6ABC, which is, are patients being admitted from other states currently?
Yeah, it's my understanding, obviously, that the catchment area for our hospitals includes areas in Pennsylvania and to a certain extent in Maryland, maybe in New Jersey as well. And so, yeah, there would be patients coming from other states to hospitals here in northern Delaware. We actually have Delawareans who go to Salisbury Hospital there as well. And so we treat patients in those hospitals from whatever state they come from.
Yeah, Governor, and if I could add, there's a federal regulation that's called EMTALA, and it basically means that an emergency department cannot turn away a patient. So it would be illegal for hospitals to screen out or to only focus on Delawareans. They have to treat anybody who comes in medical distress, again, regardless of state of residency.
And it looks like that's all the questions we have from press.
Yeah, and so just to go back, I hope we have this slide up on the screen, your screen, that it's been brought to our attention about these 3 winter viruses that we're worried about, stressing our hospital in particular and healthcare resources. And by the way, very challenging for our elderly populations and our little ones. And so there are lots of protective measures that we can each take. They're pretty similar to what we've been talking about from the beginning. We've got a very high percentage of our population, particularly the elderly population, that's fully vaccinated. We need to make, for COVID-19, we need to make sure that they get their booster shot as well. Those percentages aren't quite as high. We need folks to get their flu shots. We're almost to 60% for 65 and over on flu shots as well. So some good news there. Just we need people to think about as we move into Thanksgiving, into December holidays, and into the new year, the kinds of settings that you'll be in. If you're sick, really you should stay away from family members and friends to the extent that you can. Wear a mask to protect others, really more than yourselves. And we thank our healthcare professionals who are doing just an extraordinary job. They're very difficult circumstances. We thank Dr. Pazzi for being with us today, representing all those providers across the state, and particularly in her organization at Christiana Care, their largest hospital system. And our really effort is just to get the word out that there are things that we can do individually to help and protect others as we move into this season where we expect to get an increase in COVID-19 cases. Again, much better prepared than in the previous 2 years. And then we have the other two virus, the flu and the RSV, to be concerned about as well. So again, thank you for joining us. Thank you to our healthcare providers for the work they do. And we look forward to seeing you next time.